Well, May is ALS Awareness Month. We have some special guests joining us this morning to tell us more about this debilitating disease. Harold, we'll start with you. You were actually diagnosed with ALS recently?
July of 2008.
Okay.
And first started displaying symptoms about a year prior to that.
What did you notice?
Just weakness in the legs. Started going to my primary care physician, and they started the testing.
Okay, all right. Does this run in your family? Did you have any warning that...
I do have three other relatives that did have it, yes.
Okay, all right. How has it changed your life?
It's limited my life some. I have a lot of friends and family around me, loved ones that help out a lot, so I'm thankful for that.
Right.
That makes a big difference.
Getting around physically, is it more challenging?
Yes, it is, a little, yeah.
Okay.
But I do it.
Right,
yeah,
right.
I do it.
You're a trooper.
Yes, that's right.
And also joining us this morning is Dr. Rothstein. Right now there's no cure for ALS, but there's a trial underway right now?
Yes, it's a pretty exciting time for Harold in particular. Mr. Smith's version of the disease is the inherited form of ALS. Most ALS just happens out of the blue, as does Alzheimer's and Parkinson's disease, other neurologic diseases that are adult and chronic. But he inherited the disease in his family, and we have a very special new drug that's being tested in patients who have the inherited form. That's never been tried before, ever, in ALS, or actually any other neurologic disease. So it's a very special trial that's just starting at Hopkins very shortly. And we're really excited about this because the thrust of this is to actually turn off the bad gene that's causing this disease, take away the insult. And with that, we'd hope that we stop the disease, maybe even allow his body to heal again.
Sure. Any idea how soon that drug may be out?
Oh boy. We're at the very earliest stage of doing this trial. Trials go through many stages before the FDA eventually will approve it. This is the earliest stage. It's called phase 1. We're really just seeing, technically, is it safe to do this? Of course, we're really looking at him to find out, it's not just safe, but will we change his disease? Because that's what we hope for.
Right, right. And Laura, I mean, this is such a huge potential breakthrough, something that's really needed because right now there's no cure.
Correct. And the other thing that we have is a multidisciplinary ALS clinic team that physical therapists, occupational therapists, the Muscular Dystrophy Association, Laurel Gaffney, graciously fund our clinic both for ongoing multidisciplinary care in addition to exciting research breakthroughs. So it's multifaceted. We have support groups, again, funded by MDA. So it's a valuable resource. We couldn't do it without MDA, but this particular trial is very exciting.
Sure.
To help patients along the way, but hopefully make a dent in cures.
Right. And until a cure comes out, I mean, there's help for people now who deal with it.
Yes.
Can you tell us about that? We
have a multidisciplinary clinic of physical therapists, occupational therapists, people like myself that have been in managing and caring for the disease for a number of years, 20-some years. So we have expertise at Hopkins in helping patients both cope with the physical, the emotional, the psychological. Everyone who gets the disease, their entire family is affected, and it's just devastating. And so it's important that you support them along the way.
Sure, and I guess the message for people who are watching is if you know somebody or if you've been recently diagnosed with ALS, I mean, you're not alone. Look at all the people here. There's a lot of resources out there?
Absolutely. The Muscular Dystrophy Association, there's local offices. In addition to just picking up the phone and calling Johns Hopkins ALS Clinic, we can screen you for research trials, and we can also get you into the multidisciplinary clinic.
Okay.
So again, that number is 410-955-8511. And if you're interested in this trial or know of someone that needs some help, we're out there to help.
Okay, thank you so much, everyone, for coming in. You are a trooper. Thank you very much. Cherie?